Having a moment of calm is like finding a safe space. It's essential for mental health. But not everyone has access to it. Imagine feeling a constant sense of unease every time you step outside, whether it's walking through a dimly lit street, navigating an overcrowded bus, or avoiding an isolated park. For many women, these poorly designed spaces aren't just inconvenient, they take a toll on their mental health. As an urban planner, I've seen how the design of our cities deeply impacts mental well-being, especially for women and marginalized genders. Our environments shape our safety, comfort, and freedom, all of which are crucial for mental health. For example, fear of harassment in poorly lit areas or isolated spaces increases anxiety and restricts freedom. Lack of access to clean, safe public toilets can cause stress and deter women from participating in public life. The mental health toll of constantly navigating unsafe environments can lead to hypervigilance and social isolation. Gender-inclusive planning, like well-lit streetlights, mixed-use neighborhoods, and accessible public transportation, creates safe environments, reducing stress for women and marginalized genders. Having access to safe public spaces allows individuals to connect socially, improving overall mental health. Women often feel unsafe in isolated parks, which makes them unable to reap the mental health benefits of nature, such as stress reduction and relaxation. We need better designs, like parks with clear sightlines, multiple access points, and community activities to make them more inclusive and beneficial for mental health. Many women rely on public transit daily, and while it's unsafe, the mental toll is immense. Poor urban design, like inadequate or unsafe public spaces, lead to stress for women and marginalized genders who often juggle multiple roles, working and caregiving. Gender-sensitive transportation systems reduce mental strain by making daily commutes safer, easier, and less exhausting. Inclusive urban spaces foster connection and belonging. When women feel safe, they can build relationships and thrive emotionally. They can also pursue opportunities without fear, empowering us and reducing feelings of helplessness. So what does this have to do with South Asia? Urban spaces in South Asia, where gender disparities in public transport are more pronounced, impact women's mental health. While culturally inclusive, urban design could create safer and more accessible environments for women to thrive. So what can we do to create better urban environments? We can use tools like gender mainstreaming, gender-sensitive infrastructure, and we can address the gender data gap. So what are these tools? Let's start with gender mainstreaming. Gender mainstreaming is about making sure both men's and women's needs are considered in every decision, from policies to city planning. It means recognizing that men and women use public spaces differently and making changes that benefit all. Take Vienna, for example. When women voiced their concerns about safety on public transit, the city listened. They improved lighting, created safer routes, and made the city more accessible to everyone. Imagine if we applied this to India, creating cities that prioritize safety for everyone. What if we started by asking people, especially women, what they actually need? Next, let's talk about gender-sensitive infrastructure. Imagine parks with clear lines of sight, public transportation that's safer and easier to navigate, and bathrooms that are clean, well-lit, and secure. Sounds simple, right? Gender-sensitive infrastructure is about designing public spaces and services that meet the needs of everyone, especially women. By focusing on these details, we can significantly reduce the risk of violence and harassment, making communities safer for all. And lastly, let's talk about addressing the gender data gap. Imagine a patient going to a hospital for a kidney problem, but the doctor prescribes lung medication without asking any questions or running tests. Problematic? Absolutely. Ignoring women's needs while imposing solutions often fails, and it affects half of the world's population. In Carolyn Criado-Perez's book, Invisible Women, she highlights how much of our world is designed without considering women's unique needs. The gender data gap exists because we don't collect enough data on women's experiences. In urban planning, the gender data gap often means cities are built without considering women's daily realities, like how far they have to walk to water sources, navigating unsafe transit stops, or access restrooms. By gathering more information about what women need and face, policymakers can create better, more inclusive policies that truly protect and support everyone. Addressing the data gap can lead to safer, more equitable communities for women across South Asia. Work like this is already happening with the Gender Lab. If we design our cities to be safe, we don't just make them better for women, we make them better for everyone. Safer spaces mean healthier communities, stronger social bonds, and bright futures for all. It starts with listening, learning, and acting. If we all start asking for safe, more inclusive spaces, we can change the way our cities work for everyone. What change would you like to see in your city? Let me know in the comments.